You used to be ready in seconds. Now it takes longer. It's softer than it used to be. And some nights, nothing. I'm not here to shame you for that. I'm here to explain exactly why it's happening and what you can do about it starting tonight. Hi, I'm Dr. Ella Parker. I'm a certified men's sex therapist with over a decade of clinical experience, and this channel exists for one reason: to give men the honest, science-backed conversations about sexual health that nobody else seems willing to have. We talk about the real stuff here, the stuff men whisper to their doctors or don't say at all. And today's topic? It's one of the most common things I hear in my clinic from men over 40. Before we get into it, if this is your first time here, hit that subscribe button right now. Every week I put out videos designed specifically for men who want to understand their bodies, perform at their best, and feel confident in the bedroom well into their 40s, 50s, 60s, and beyond. You don't want to miss what's coming. Subscribe. Let's go. Section 1. What's actually happening to your body after 40? Let's start with the science, because understanding what's happening inside your body is the first step to changing it. When you get an erection, your body releases a molecule called nitric oxide. Nitric oxide is the signal that tells the smooth muscle tissue inside your penile arteries to relax and open up. When that happens, blood rushes in, pressure builds, and you get an erection. Here's the problem. After the age of 40, your body's ability to produce nitric oxide starts to decline. Your arterial walls become slightly less elastic. Your blood vessels don't respond as quickly or as fully as they used to. And on top of that, testosterone, which plays a supporting role in libido and sexual function, drops by roughly 1% per year starting around age 30. By the time you're in your mid-40s, you may have lost 15 to 20% of your peak testosterone levels. Now, here's what I need you to hear. This is not a death sentence for your sex life. These are biological shifts, normal ones, and most of them are not only manageable, they're reversible. The men I see in my clinic who struggle most are the ones who assume these changes mean something is fundamentally broken. It isn't. Your body is shifting. And when you know how to work with that shift instead of against it, the results can be remarkable. I've had men in their 50s tell me they're having better sex than they did at 30. Not because they found some magic pill, but because they finally understood how their body actually works. Let's talk about why this is happening to you specifically, because the causes are often hiding in plain sight. Section 2. The 5 hidden culprits nobody warns you about. Most men assume erectile changes are purely about age or testosterone. But in clinical practice, what I see far more often is a combination of 5 specific, modifiable factors that are quietly undermining sexual function. Let's go through them. Culprit number 1. Poor sleep. This one catches men completely off guard. Testosterone is manufactured almost entirely during deep, slow-wave sleep, not resting sleep, deep sleep. If you are consistently getting fewer than 6 hours per night, your testosterone production is being cut off at the source. Studies have shown that men who sleep under 6 hours have significantly lower testosterone than men who sleep 7 to 9. One bad week of sleep can measurably reduce your erectile quality. 1 week. This isn't small. Culprit number 2, metabolic health. High blood sugar, excess body fat, particularly around the abdomen, high blood pressure, and elevated cholesterol all damage the endothelium. The endothelium is the thin inner lining of your blood vessels, and it is exactly where nitric oxide is produced. When your metabolic health is compromised, so is your erectile function. The two are so closely linked that erectile dysfunction is now recognized by cardiologists as an early warning sign of cardiovascular disease. Your erection is literally a report card on your vascular health. Culprit number 3, chronic stress and elevated cortisol. When you are stressed, your body releases cortisol. Cortisol is a vasoconstrictor. It literally narrows your blood vessels. It also suppresses testosterone production and diverts blood flow away from your genitals and toward your major muscle groups because your body thinks you're in danger. Chronic stress keeps cortisol chronically elevated, and chronically elevated cortisol is the enemy of reliable erections. If work, finances, or relationship tension are a constant presence in your life, they are showing up in your bedroom whether you realize it or not. Culprit number 4, medications. This is one of the most overlooked causes I see clinically. Beta blockers for blood pressure, SSR, is for anxiety or depression, certain antihistamines, prostate medications, and even some common over-the-counter drugs can significantly impair erectile function. If you started experiencing changes around the same time you started a new medication, that connection may not be a coincidence. I am not telling you to stop taking prescribed medications. Please do not do that. But it is absolutely worth having a conversation with your doctor about whether your medication is affecting your sexual function. There are often alternatives. Culprit number 5, the performance anxiety loop. This one is arguably the most damaging of all, and it's almost entirely psychological. Here's how it works. You have one difficult night. Maybe you were tired, stressed, or had a few drinks. Your erection isn't what you expected. That plants a seed of worry. The next time you're intimate, that worry activates your stress response. Your cortisol spikes, your blood vessels constrict, and the erection you were anxious about not getting doesn't come. Now the loop is locked in. Every sexual encounter becomes a performance test. And the more you monitor yourself, the worse the anxiety gets, and the worse the erectile function becomes. I see this in men in their 40s who are completely physiologically healthy. The body is fine. The loop is the problem. Section 3, the 5 evidence-based fixes that start working. Fast, all right. Now that you know what's working against you, let's talk about what works for you. These are not guesses. These are evidence-backed interventions that show real results, some within days. Fix number 1, exercise. Specifically, this combination. A landmark study published in the Journal of Sexual Medicine found that aerobic exercise alone, 30 to 40 minutes, 4 times per week, was comparable to PDE5 inhibitor medications, the drugs in Viagra and Cialis, for men with mild to moderate erectile dysfunction. That's exercise on its own, matching pharmaceutical intervention. But here's what makes it even more powerful. When you add resistance training to your aerobic exercise, you also stimulate testosterone production. The combination of cardio for vascular health and strength training for hormonal health is the most potent non-pharmaceutical intervention available to you. Start with 30 minutes of brisk walking plus 2 resistance training sessions per week. That's your floor. Fix number 2, the Mediterranean diet. This is not a trendy diet. This is the most consistently research-validated dietary pattern for erectile function. The Mediterranean diet, rich in olive oil, fish, leafy greens, legumes, nuts, and whole grains, reduces inflammation in the endothelium, improves nitric oxide production, and supports healthy blood flow. In clinical studies, men who shifted to a Mediterranean-style diet reported measurable improvements in erectile function within 8 to 12 weeks. You don't need to overhaul everything overnight. Start by replacing processed foods with whole foods and adding more fish and vegetables. That alone moves the needle. Fix number 3, pelvic floor training. Most men have never heard of this, and it is one of the most underutilized tools in men's sexual health. A randomized controlled trial published in BJU International found that pelvic floor exercises were more effective than Viagra for some men with erectile dysfunction and produced lasting results that outlasted the study period. Your pelvic floor muscles are directly involved in achieving and maintaining erections. To train them, find the muscles you use to stop urination midstream. Contract them for 3 seconds, release, repeat. 10 repetitions, 3 times per day. Within 6 to 8 weeks, the difference can be significant. Fix number 4, protect your sleep. Like it's a prescription, set a consistent sleep and wake time, even on weekends. Keep your bedroom cool and dark. Eliminate screens for 45 minutes before bed. These are not soft suggestions. Sleep is when your body does the biochemical work that makes sexual function possible. Treating sleep as optional is treating your testosterone as optional. Prioritize it with the same seriousness you'd give any other health intervention. Fix number 5, break the anxiety loop. If performance anxiety is part of your picture, the fix is not to try harder. It's to remove the performance pressure entirely. This means taking penetration off the table temporarily and focusing on pleasure, sensation, and connection without expectation. This approach, called sensate focus in clinical practice, consistently breaks the anxiety performance loop by decoupling intimacy from performance outcomes. When the pressure lifts, the physiology often follows. Many of my clients are surprised by how quickly this works. Section 4. The one-night fix. What you can do. Tonight. You don't have to wait weeks to feel a difference. Here's what I want you to do tonight. First, no alcohol. Even 1 or 2 drinks measurably suppress nitric oxide production and blunt your nervous system's arousal response. If you want to perform well, skip the drink tonight. Second, take a 20-minute walk after dinner. This boosts nitric oxide, reduces cortisol, and improves circulation in the hours that follow. It sounds almost too simple. Do it anyway. Third, get off your phone by 9:30. Blue light suppresses melatonin, delays deep sleep, and interrupts the testosterone production window. Put it down. Fourth, before you go to bed, spend 5 minutes doing the pelvic floor exercises I described. 3 sets of 10 contractions. It takes less time than brushing your teeth. And fifth, if you're going to be intimate tonight, let go of the outcome. Focus entirely on sensation and connection. Remove the scoreboard. Your body performs best when it isn't being watched. These 5 things tonight. That's it. Here's the reframe I want to leave you with. The changes you're experiencing after 40 are not your body giving up on you. They are your body asking for something different from you. Better sleep, better food, more movement, less stress, more presence. The men who thrive sexually in their 40s, 50s, and 60s are not the men who are immune to change. They are the men who paid attention, made adjustments, and stopped letting embarrassment keep them from understanding their own biology. You have more control over this than you have been led to believe. The research is clear. The interventions work, and you don't need a prescription to start. Start tonight. One change, one step. Your body will respond because it is designed to. If this video gave you something useful, do me a favor. Share it with a man in your life who needs to hear it. The silence around men's sexual health is only broken when we actually start talking. Subscribe if you haven't already, and leave a comment below telling me which of these 5 fixes you're going to try first. I read every single one. Next week, we're going into something I get asked about constantly: what low testosterone actually feels like, and how to know if yours is the problem. You won't want to miss it. I'm Dr. Ella Parker. I'll see you in the next one.